A forceful thrust beneath the ribs and up into the diaphragm can compress the air in the chest and pop the object out of the airway. Direct compression of the chest over the breastbone can also create enough pressure to expel an object. You must be able to recognize the difference between a mild blockage and a severe blockage. With a mild blockage, a person can speak, cough, or gag. This type of blockage is typically cleared by coughing. Encourage someone with a mild blockage to cough forcibly. Stay close and be ready to take action if things worsen. When a severe blockage occurs, a person cannot dislodge the object on his own. Signs of severe obstruction include very little or no air exchange, lack of sound, and the inability to speak or cough forcefully. The person may hold his hands to his throat as he attempts to clear an obstruction naturally. Your help is required to save the person's life. To care for someone who you suspect is choking, begin by asking, "Are you choking?" If the person nods yes or is unable to speak, cough, or cry, act quickly. Stand behind the person, reach around and locate the person's navel with your finger. Make a fist and place the thumb side against the abdomen, just above your finger and below the ribs. Grasp your fist with your other hand. Give a quick inward and upward thrust. Repeat thrusts. Each thrust needs to be given with the intent of expelling the object. Repeat thrusts until the person can breathe normally. If the person becomes unresponsive, carefully lower her to the ground. If not already done, activate EMS. Begin CPR, starting with compressions. Look in the mouth for an object after each set of compressions before giving rescue breaths. Remove any object if seen. Continue until the person shows obvious signs of life, or another provider or EMS personnel take over. When someone is clearly pregnant or obese, use chest thrusts instead of abdominal thrusts. Position yourself directly behind the person. Reach under the armpits and place the thumb side of your fist on the center of the chest. Grasp your fist with the other hand and thrust straight backward. Try to not put pressure on the ribs. If you are alone, try pressing your abdomen quickly against a rigid surface, such as the back of a chair. If one is not available, attempt abdominal thrusts on yourself. Abdominal and chest thrusts can cause internal injury. Anyone who has been treated for choking with these maneuvers should be evaluated by EMS or a physician to ensure there were no injuries.